Hey there, Chris Linder. I am a certified athletic therapist, and I'm going to talk about groin strains today. Why groin strains? They're near and dear to my heart. I just basically pulled my groin playing men's league hockey. I had my foot taken out from under me, felt the pop and immediate pain, and now I'm left to recover from a groin pull. So they're top of mind. I thought I'd create an educational video for you on groin strains. I've also had a extensive amount of experience working in many levels of hockey, excluding several years working in professional hockey. So I have been involved in rehabbing multiple groin injuries, working into the dozens during my career. So first, groin pulls, groin strains. What the muscles that are being injured are called adductors. You'll see right here. The reason they're called that is because their primary movement is to bring the leg out to in, like that. So basically bringing your leg closer to your midline. What other motions do? They actually are involved in a lot of different things. They flex, which is bringing the knee up. They extend, which is bringing the knee down and back. And they also internally rotate. So internal rotation is like that, which is if you bend your knee, you will rotate so your foot goes out and your knee points in. Because of this, they support a lot of different muscles, such as the hamstrings, the glutes, the hip flexors. They're very important in stability and really complex movements, such as skating, as I experienced, and movements that create a lot of lateral movement and change of direction. This also occurs in a lot of sports like soccer, football, lacrosse, basketball. So the groin injuries are quite common in many different sports. It can also occur in the everyday person just from slipping on ice or suddenly returning to a weightlifting program and trying to squat deep. While it's not common, an acute injury in that position, but you can get some groin pain from that. So how does it get injured? So MOI here means mechanism of injury. You can have an overstretch, similar to mine, a sudden contraction, is when the muscle is contracting really rapidly, faster than it used to, and it's usually in a protective mode. So in my case, my foot was being brought out away from me. It contracted very strong, trying to protect itself and me, and it ended up getting injured because of it. So most injuries you see when you feel sudden pain in the inner thigh, in this region, like if one of these muscles is injured, this is what you're experiencing. They can also be injured in a chronic sense. And with my background in hockey, many hockey players know like a sore groin creeps up, gets worse and worse to the point it affects how you perform. This is a chronic nature of it building and building and building up, which is actually more common than you would think. So the types of groin strains you can get are graded 1 to 3. So you have grade 1, which is easily described as an overstretch, as in it gets slightly overstretched, the fibers. You do get some muscle fiber damage. You don't get a lot of swelling and pain. This is one you may be able to perform your sport through with some support from a tensor bandage or a special pair of shorts called a core shorts. This depends on your sport and how severe the grade 1 strain is. When you get into a grade 2, this is easiest described as a partial tear. This doesn't necessarily mean that the tear is torn like this, like a piece of paper. It might just be part of the muscle is starting to pull apart like that, creating basically a soft spot because the muscle fibers have been damaged, and this is where the swelling and inflammation will collect in the muscle. And grade 3, you're looking at a full tear or very close to a full tear. So not in one of the muscles, this would be like only upwards of like 20% of the fibers may be remaining, or you may eventually fully tear it. These are quite severe injuries. You will likely have a lot of bruising, and you will not recover quickly from. So what do you do when you get a groin strain? You protect it, whether that's with a compression bandage or a special pair of shorts, a tensor bandage to allow your leg not to fall away from yourself, so the muscle doesn't have to work very hard. You want to create optimal load, And this will change based on the injury. So there might be a period of complete rest for that muscle at least. You can still train the rest of your body. Or you might be able to do light activity with it, whether it's walking, light contractions, or general 2-foot body weight movements like squats, for an example. Icing. Ice is really great for controlling the pain. It does have some it does limit swelling and inflammation some, but it's really hard with a muscle mass that's that thick in the thighs to really get the ice deep and really reduce the swelling. So in general, what really works for controlling swelling and keeping the optimal amount of swelling and not removing it all is compression. And this is done with a compression band or a tensor bandage. Some compression shorts may be long enough and strong enough to provide compression for a groin strain. And next is elevation. Elevation is a common one for all injuries. With the groin, it is challenging. You'd have to lay upside down. All the blood would rush to your head. Probably somewhat uncomfortable. Personally, I did not use the elevation in this case because I just wouldn't feel comfortable in that position, and the amount of time I have to spend there, I wouldn't be able to get work done and do things like that. So focus on what you can control and what is easy, which is the first 4 things you do not want to do. You do not want to overload it. You don't. As I said, in grade one strains, you may be able to play, but you should get some assistance from a qualified professional such as myself and other athletic therapists or physiotherapists of if you can, what is the optimal load, and can you participate and play still. Next, don't rest too long. Some people take weeks and doing nothing and hoping to jump right back in without progressively increasing the stress on the groin muscles, which commonly leads to re-injury. Don't over ice. Icing, yes, it does feel great. There is some research out there that shows that over icing and too much ice application can actually slow down the healing process. And then I put NSAIDs, which are pain meds, which are non-steroidal anti-inflammatory drugs. While they make you feel great, they have been shown to slow down the healing process. So if you are in quite a bit of pain and it is really bothering you, like having trouble sleeping, trouble doing daily activities, utilizing ice and some pain medications such as Tylenol, Advil is okay for a short period of time. I'm not a masochist that will say, no, don't do anything to make you feel better, just suffer through the pain. All can be helped, as I mentioned, by a appropriate medical professional that has experience with groin injuries that can help you evaluate it and also catch any potential red flags. So if any red flags you see here are occurring, I highly suggest you see a athletic therapist, physiotherapist experienced in sports-related injuries, and as well as also a sports medicine physician who is experienced in these type of injuries. So these red flags are abdominal pain. So this would be getting pain. I don't have them in above your pubic bone, so up here within your abdomen. This could mean a complication with the abdominal wall, which is a really bad problem to have, and you want to make sure it's taken care of properly. Pubic bone pain, whether that is central in the pubic symphysis or is it right where the muscles attach. This is something to look at further to make sure you do go through the proper steps to recover properly and you do not have further complications down the road. Bruising, or I should say massive bruising. So if you get bruising that goes all the way down your leg and it's black and blue, this does indicate you're more towards a more serious grade 3 strain, which is something that, as I said before, needs to be managed correctly. Then if you have any pain, tingling, or anything radiating, or any numbness, whether it's going down your legs or even into your genitals. This can occur because your adductor muscles are right by your private parts. There can be complications with them. So definitely if this is a problem, this is something you want to have further evaluated. So I hope you've enjoyed this video and found it educational. If you have any questions, please post in the comments or send me a message. If you're in the Calgary, Alberta area, I'll include the link to book an appointment with me so I can work with you personally.